I'm Siobhan Sarna with the SIBO SOS Summits and the IBS and SIBO SOS Summits. It's good to have you here. Dr. Michael Ruscio is joining me right now, and we're going to be talking about hormones and the gut. So I know everything's all related. I know you know that everything's all related and all that. But when you hear about how the hormones that he's going to be talking about are related to our everyday digestion, it was a wake-up call for me. I wonder if it's going to be one for you. I bet it is. Thanks for being here, Dr. Ruscio.
Thanks for having me back.
So let's talk about hormones and the gut and digestion. Like I just said, I know everything's related, but
Sure.
I don't think I realized how tightly related that was. Like thyroid, estrogen, all that jazz with the digestive system.
Well, it's why I recommend that people not necessarily try to diagnose what is wrong with them based upon symptoms, because the symptoms of adrenal fatigue and hypothyroidism and female hormone imbalance have a lot of overlap, but rather to try to work through a hierarchy. And that hierarchy would be first get on a halfway decent diet, tend to your lifestyle, and then if you're not feeling better, fix your gut. Because the adrenal symptoms, the female hormone symptoms, the thyroid symptoms may all be coming from your gut. Yes, keep your conventional doctor looped in, and if they tell you have a thyroid problem that needs medication, follow their advice, right? I'm not saying disregard what your conventional doctor is saying or to stop seeing your conventional doctor. But if you're looking for the underlying cause of a lot of these symptoms, the gut is often it. And as it pertains to hormones, there's three main connections: adrenal hormones, female hormones, and thyroid hormones. And we can start with whichever one.
Let's start with thyroid.
Sure.
Thyroid. Because I think there's a lot of confusion about that in general. Let's say somebody is tuned into the thyroid concept that like, hey, there is a connection. There's still a lot of confusion about it.
There is. There's a lot of confusion. There really is. And I think a lot of this emanates from educators and providers wanting to help people, but perhaps not fully realizing that we have to be very careful with the language that we use, because it's so easy for the public to misconstrue or misinterpret something that we're saying. And so what ends up happening oftentimes, to say it succinctly, is what people think and what actually is are different. And people oftentimes think that their prognosis or the situation is far worse than it actually is. So hopefully, and I know that's kind of broad and vague, we'll fill that in with more details in a moment, but hopefully that's a little bit reassuring to people. Regarding thyroid, there's probably, there's the autoimmune connection. So we know that improving someone's gut health can improve autoimmunity. We know it can reduce someone's need for medication. But I want to be very careful in clarifying, this does not mean to self-decrease or self-stop your medication. What it may mean is that if you improve your gut health, your blood work will show you no longer need as high of a dose of medication, and that your prescribing doctor should clearly see that and will adjust your dose. And just want to be careful there, because it's easy to misconstrue that. And then thirdly, the tie-in with hypothyroid-like symptoms, because sometimes people are chasing down a symptom they think is being caused by their thyroid, but it's actually coming from their gut. And just to fill those in a little bit, there's been one study published that has shown that treatment of H. pylori can improve thyroid autoimmunity, and one study published showing that a carb-restricted diet can also improve thyroid autoimmunity. And it also suggested in that study that those patients may actually have a degree of FODMAP intolerance. So that's very interesting. And we also know that there's a high association between between SIBO and hypothyroidism. And to the medication piece, I've seen a number of cases that were able to decrease their thyroid medication, or it was just so apparent that their endocrinologist said, yeah, we need to cut down your levothyroxine dose or your dose of whatever medication that they were on, because their hormone levels in the blood were going up, 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 up. Why? Because they were absorbing their hormone better, therefore they needed less.
Got it. Can you just tell me hypo versus hyper in case someone is like me and
Sure.
gets this
Sorry,
confused?
I'll zoom this out a little bit.
Okay.
Hypo means slow, hyper means fast. So,
well, hyper's fast. Okay, that's easy.
So hypo, you don't have enough hormone, more so associated with fatigue, a marginal amount of weight gain, potentially constipation, dry skin, dry hair, dry nails, some of the most common symptoms. And then hyperthyroidism, people can also be fatigued, but it's more of you're too sped up.
Wired but tired.
That you're burnt out kind of fatigue. Exactly. There can be hair loss, oily skin, insomnia. Racing heart and feeling hot are probably two of the more distinctive symptoms of hyperthyroidism or Graves. But we know that the autoimmunity that underlies hypothyroidism and possibly hyperthyroidism can be improved by improving one's gut health, that you may need less medication. And then perhaps most importantly is the symptoms that you're attributing to hypothyroidism may actually be driven from your gut. And so if you're on medication and you're saying these symptoms still aren't responding, yes, sometimes there's a need to change the medication. But if you're in the normal range, and people will criticize, well, my endocrinologist isn't using narrow enough ranges, or I've heard whatever. Yes, that there's a time and a place for that. But I would first say, look at your gut health, because the fatigue or the constipation or the weight gain or the depression or the brain fog that you're experiencing may not be because of your thyroid. It may be because of your gut. And again, it's not to say it couldn't be a need for more of an investigation into the thyroid, but I can't count the number of patients who come in thinking that they need more of a detailed thyroid evaluation. We improve their gut and all those symptoms go away.
Fantastic. Yeah. Fantastic. Okay, so I have taken thyroid medication as an experiment, and it improved my digestion like crazy, but my hair fell out. So there it is.
Yeah.
That was a problem.
If you give thyroid hormone to people that don't need it, it oftentimes does not go well. And you make a very important point, which is now that we have this interest in integrative or functional thyroid care, some patients are being put on thyroid medication who don't show true hypothyroidism. And they're being given this medication more as a support. Mm-hmm. But the problem is that the clinician is not telling the patient your thyroid is essentially normal or it's functionally slow, and we're giving you this medication as a support. And when they don't do that, people are assuming that they have the disease of hypothyroidism. Why this is relevant is because if you're being given the hormone as a support, you can come off it. It's only an additional add-on, right? If you have diagnosed thyroid disease, hypothyroidism, you very likely will need that medication for the rest of your life. I've seen a number of cases that come in on thyroid hormone and they thought that they were hypothyroid. And you know me, I have a BS detector, right? And so I said, can you send me the labs from before you were put on the thyroid hormone? I just want to check this. And there have been a number of cases that were walking around for years thinking they had thyroid disease. And they were just being given the hormone as a support. And there was no substantiation for needing that hormone even to begin with. That's very important. I have no, if a clinician wants to give someone thyroid hormone as a support to see if it helps them, I don't necessarily have a quarrel with that. I think you should be careful, but I don't necessarily have a quarrel with that. Like using testosterone in a guy who doesn't necessarily need it, but he's looking for a little bit of a performance bump, right? But will the guy be able to come off it? Yes, right? Will the person be able to come off the thyroid hormone? Yes. You need to know that compared to I have hypothyroid disease and I'll need this for the rest of my life. And lab work can tell you that fairly easily. And without getting too detailed here, but if you have, according to the conventional ranges, high TSH paired with low T4, then that is indicative of hypothyroidism. Now, what some
Can you say it one more time before we move
so
on?
according to the conventional ranges, so this means the lab, if it's LabCorp or Quest, they will flag it high or low. Right? If you have flagged high TSH coupled with flagged low, usually it's free T4, then that is indicative of hypothyroidism. And those cases, for the most part, will need to be on thyroid medication for the rest of their life. Now, the higher the TSH is, the worse the prognosis is, in the sense that, and I shouldn't say worse, but the higher the likelihood that they will be very dependent upon that hormone. So if you have a TSH of 6 compared to a TSH of 61, that can indicate, how foregone thyroid function is. But what will happen in some circles is a functional provider says your TSH shouldn't be above 2.5, even though the upper cutoff is usually 4 or 4.5, roughly depending on the lab. So the functional doctor says you shouldn't be above 2.5. Someone comes in at 3.1. That's still normal according to the conventional ranges. And their T4 is also in the normal range, but it's toward the lower end. And they say, oh, your thyroid's kind of slow. And they give them a thyroid medication. And they don't clarify that there's not a diagnosable hypothyroid condition present, but rather they're using it as a support. And if that person stops seeing that clinician and it just kind of gets carried forward, or if they just keep getting the refill on the prescription, they could be years and years later on that thyroid hormone, all the while thinking that they have hypothyroid disease and not understanding that they don't need to be on the medication. And that's a little bit nuanced, but it's just important to understand some of those details.
Oh, absolutely. And shouldn't you recheck periodically too?
Oh, absolutely. Yeah, but I'm sorry. Once you're on the thyroid hormone, you can't get the read of if you no longer need it, because now the hormone is affecting your blood level. So that's why looking at the tests from before when someone started medication is very important.
Got it. Ooh, so why would someone's hair fall out? Why did my hair fall out? It was like a lot of hair fell out.
So that's one of the symptoms of hyperthyroidism. And so sometimes what happens is, if I'm just going to be honest here, you get a thyroid fanatic, right? Someone who thinks that everything is caused by thyroid, and they're not practical, and they're not being discerning and judicious. And they've swallowed the pill, I guess pun intended here, that thyroid problems are the cause of all ills. And they start treating everyone as such. There's that old adage, if all you have is a hammer, everything looks like a nail, right? So their hammer is thyroid hormone. But in people who have levels of thyroid hormone that are too high, as in hyperthyroidism, as we see in Graves, one of their symptoms is falling hair and losing hair. Okay. So, when we look around, we very clearly can see that thyroid can be very helpful, but it's not this panacea where just give more or just give more T3 and someone's going to feel better. It's we want to get you into the normal range. That's step one. And then rather than getting super particular with detailed ratios, I would next look at your gut health, because that may be the underlying cause of the non-responsiveness of your symptoms, or even if your TSH is unstable, that could be due to malabsorption. And there have been some studies, for example, with patients with ulcers, so problems in the stomach, that can't get their TSH stable. They then give them a liquid gel tab of thyroid hormone that's much more easily absorbed. TSH normalizes, symptoms improve.
Wow.
So absorption is important as it pertains to thyroid hormone, which is why, if those patients who had the ulcers started trying all these fancy experiments, they may never get there, right? They take the different form of thyroid hormone, which is more easily absorbed, and they do very well. Or another way of coming at that would be to fix the gut so that you enhance the absorption of the tablet that they're taking.
It does. It's very interesting. It's another frontier for a lot of people to explore.
And you have to explore it carefully. It's bad. You know, I hate to sound like a contrarian sometimes because I feel like I do both in gut work and in thyroid work. But it's only a byproduct of seeing patients come in making themselves sick out of what they read on the internet. And I'm not blaming that all on the doctor or the author. I'm blaming some of it on them because
Sure.
some people clearly need to be called on the carpet on this stuff. But there's also this very easy ability to fall into overzealousness. And it doesn't help anybody. And so you have to really navigate this stuff carefully.
It's hard because if your local doctor, GI, or hormone, maybe you don't have some. Look, where I live, there is only 2 or 3 people in this entire big metropolitan area that I would consider qualified to do functional medicine hormone testing.
And hormones are tough because most of the time you have to be seen at least once per year by the clinician in order to prescribe. So the distance telemedicine model is a bit more confined when it pertains to hormones. But I would come back to my original statement that your general practitioner or your endocrinologist, they're probably going to do a fairly decent job with this stuff. But the missing piece may be your gut. Right. So again, rather than trying to force your endocrinologist into putting you on Armour or Nature-Throid or giving you the addition of a T3 hormone in addition to your T4 that you're already taking, rather than trying to get them to change their whole paradigm, it may be easier and more fruitful to try to fix your gut first. And then after that, if you're still struggling, there's more advanced thyroid things that you can go into. But the point I'm trying to make is we may be putting the cart before the horse with getting really meticulous with our ratios and our dosing of different types of thyroid hormones if we do that before optimizing someone's gut.
Sounds like a plan. Thank you very, very much.
You're welcome.